This is your Houston chiropractor, Dr. Gregory Johnson, and today we have a very special patient that's come in all the way from Miami, Florida, from watching our YouTube videos on hiatal hernia correction. And her name is Laura Landfield, and she is a published author, and the name of your book is?
Bail Bonds Babylon.
There you go, Bail Bonds Babylon. So you can find it anywhere, Amazon, I'm sure,
everywhere. Everywhere.
Yep. So we're very delighted and welcome her to Houston, and we're going to let her tell her story about how this has been for her as a process, how she found this, how she's done, and what this has done for her. So first thing we're going to do, though, is we're going to show you how we treat her, which is what we do with every patient. When we analyze them, let's look in the mirror. And I'm going to have you close your eyes and flex your head forward all the way, and backward all the way, and then neutral. Okay, now as we're looking at her posture there, I can see, and you can see, she's got some forward head posture still, and her head's also translated to the left, which makes her right shoulder high. Her head's tilted over to the right. But here's the most significant thing that I want to point out with her. In her mid-thoracic spine, she has an increased curve in here. That's called a kyphosis. And this is very pertinent to her hiatal hernia condition, because when the thoracic spine vertebra misalign, the ribs that attach to the vertebra, the transverse process, misalign back here. Those ribs travel all the way around and attach to the sternum in the front. When the diaphragm then is weakened by that rib misalignment, which is what the diaphragm attaches to, the stomach can slide up through the diaphragm and into the esophagus, and that's where it secretes acid. That's what hiatal hernia / acid reflux actually is. So we're going to bring Lenore over here on the table and have her lay face down first. Now, I am not decompressing her at this point in time, because we're starting off with her brand new treatment. So we're checking her leg length. Her left leg is a little bit short, and that tightens up a little in her low back and pelvis. And you probably saw that raise up a little bit. And it's a little tender right here in her sacroiliac joint. So we're going to adjust those first. This is the right sacroiliac joint. The middle triangular shaped bone called the sacrum. And the left sacroiliac joint, which this is the leg that was short. And then we're going to adjust her lumbar spine, L5 and the Z-axis, 4 and then 3, 2, and there's L1. Now right here is the base lower part of her thoracic spine. This is where the last ribs, or the floating ribs, come in, and this is all a very important area. Now I'm not putting any significant or hard thrust into her, because her ribs are tweaked out of place, and we don't want to create any more muscle, intercostal muscle reactions than we have to. So I'm just doing some very gentle manipulations in here, and just breathe normal for me right there. Now the main thing that you're going to see me doing with her in this area is I'm going to be working on the paraspinal muscles right here in her lower thoracic spine region. That's very tender, isn't it, Lenore? Yep, right there. Yep. Most patients usually give a few grunts and hollers on this one, because these get very, very sore. And you can see that the apex of her kyphosis right here in the mid-thoracic spine is at about T5, T6, and those nerves that come out of that region supply the stomach and the esophagus. So we've got a lower rib cage misalignment and subluxation complex going on with the lower thoracic vertebra. They go around and attach through cartilage into the front, and they are the support mechanism for the diaphragm. So what we're doing is we're working on these muscles with some pretty significant pressure from my elbow down into these trigger points, and they're very tender because they've been out for a long time. When we first saw her yesterday, she hadn't slept for 2 weeks, been in the hospital for how many days?
2.5 days.
2.5 days.
They couldn't do anything.
They ran all kinds of tests on her, including a lot of heart test to find out she was having a heart attack because she was having severe chest pain and difficulty breathing, and they couldn't find anything wrong with her after about $15,000 worth of treatment and diagnostics. So she, after they found out that there was nothing pathologically wrong with her medically, she booked a flight here to Houston from Miami, and her husband, Clive, who's also famous, and we'll get to him here in a few minutes, but he accompanied his wife, and he's also receiving treatment too, so we'll introduce you to him in a few minutes. Yeah, now that's very tender on patients when you first start that, so.
Are they getting all the sounds?
Yeah. Now, this is, of course, what you've all seen before. It's called the Terminator. It's a modified jigsaw that actually gets in deep into the tissues and creates a myofascial release on the muscles. So we're going to start that in here and get your action breathing. It's really sore all through this whole region. Yeah, especially right here at the apex. Yeah, right here at the lower dorsal. Okay. So.
Thank you for stopping.
Now we're going to actually use a Genie Rub to do some deep vibratory sense muscle work, which will improve the circulation into the tissues, will bring oxygen and nutrition into the tissues, but more importantly, will allow these muscles and ligaments metabolic waste products from normal cellular metabolism to get out of the muscles and not be so sore and stiff, which are what the trigger points or knots are. They're just basic toxic metabolic waste dumps, and we're certainly not calling Lenore a waste dump, but she's got lots of toxicity in these muscles, which is contributing to the perpetual rib misalignment, because remember, ligaments hold bone to bone and muscles move the bones. There we go. I'm sure you picked up on now, I've been calling her Lenore, and her book name is Laura. So
That's because I'm incognito some of the
that's
time.
because she's incognito at the Bell Bonds Babylon stuff, and it's a very interesting read that you guys should pick up and look at and see, because it's a very interesting story about her family and her life as a bail bondsman and all the stories that come along with those kinds of things. Some fairly notorious things happen in that business.
Absolutely.
Makes for an interesting read and an interesting life. And we're not going to tell you all our other secrets. You'll just have to read them and find out.
Thank you.
There we go. Now, you can tell she also has some issues with her breathing, because when these ribs are misaligned with the mid-thoracic spine vertebra, it actually does create some labored breathing. So what we're going to be doing is not only putting her rib cage back in place here in the posterior aspect, but also from the anterior aspect. That felt a lot better than the Terminator, didn't
Oh,
it?
absolutely. It was like a feather compared
Yeah.
to the Terminator.
Yeah. Now we recheck her leg length, though. It's exactly even, and it stays even. Her pelvis doesn't raise up. I bet that felt better down here too,
Much
didn't it?
better.
Yep, very good. Okay, let's turn you around on your back now, please.
This is not the easiest thing in the world to do.
Yeah.
I've done easier things.
There we go. Yeah. Just let your head relax. Right, my hands here. Yeah. we take it very gentle on her cervical spine here, and we have to find just the right amount. Now tilt your head a little bit right. There it is. Perfect.
Wow.
Smooth as could be. And same there. Very nice. Now, take a deep breath in. Let it all the way out. Now this is a kind of a mini version. There we go. Boy, that moved good. How far down did you feel that when I
All the
pulled?
way into my legs.
See, actually, when I do that decompression, if I contact the occiput and still do the decompression on the y-axis, it has a very similar effect to this, only I'm not locking the pelvic bones in to do it. So let's slide you all the way down on the table here now, Laura, and have your legs down there. And I'm going to have you put your arms straight out like this. Now what I'm doing on this adjustment is I'm adjusting the acromioclavicular joints right here. I'm adjusting the, I'm not choking her, maybe I'm not trying to choke her anyway, but the anterior clavicle where it attaches to the sternum, but more importantly these ribs right here where they attach to the sternum. And these are all very sore, aren't they? Because they've been out for a long time. She has been kyphotic in her mid-thoracic spine, which causes the ribs to go up on top of the sternum instead of fitting together right at the side of the sternum, and that makes a huge difference in this anterior wall here. Now we're coming to slide back up that way just a little bit so it's more comfortable for you. Here is my own patented, not patented, I haven't patented it, but it's my own signature technique for pulling the stomach down through the diaphragm. So take a deep breath in. Now I'm down below her xiphoid process, okay, let it all out, which is below the sternum, and I'm at the base of her rib cage. And what I've got a hold of right now is the top of her tummy, her actual stomach, the fundus, and I am actually pulling that down and then all the way down in the y-axis so that we can pull it down from, there you go, and one more time. Let it all out now. There you go. Pull that all the way back down through the diaphragm, put it in its right position, and that takes care of the acid being up into the esophagus and is what actually heals the hiatal hernia over time. So let's have you sit up sideways and face towards Renee there. There we go. Okay, now just look straight ahead for a moment. And you know this from watching my previous videos that we always adjust patient's extremities. Got a nice movement on her right shoulder there, which had a lot of crepitus in it yesterday, not so much today. This one's moving pretty good today. I'm just going to do a little adjustment on that one. And just lift yourself, we'll relax. There you go. We adjust her elbows, wrists, all the way down into her hands and fingers. But she has beautiful hands. She has absolutely no deviation whatsoever in her fingers, so there's no rheumatoid or osteoarthritis in her fingers. There's the wrist on this side. That went really well today. And I'm sure you can hear these individual phalanges popping here. That's called cavitation. When you create that pop, it's really a carbon dioxide gas that explodes inside the joint space. Okay, now let's come back over here in front of the mirror again, Lenore. And Renee, if you can do this from the side so we can see how much this helped your kyphosis. Now, we're going to have her close her eyes again and flex her head forward all the way and backward all the way. Much smoother and increased range of motion, by the way. Okay, now take a look at that. Now look already, she doesn't have as much kyphosis in this mid-thoracic spine. Her head is up and back over her shoulders more. But we're actually going to improve upon that with this adjusting instrument on the atlas. We're going to have her lift her shoulders up and hold them back here for me. Then I'm going to bring her head straight back in the z-axis, translate it a little bit to the left, and we're going to adjust her atlas right there. Same posture and same position. Hit her atlas there. This sends a barrage of neurological information into the cerebellum, which is called the hindbrain. It controls balance, posture, coordination, and all kinesthetic movement. So it's a very important vertebra, C1. Let's go ahead and close your eyes again and flex your head forward and backwards again. Now look at the difference in range of motion. Much, much better and much smoother too, huh?
Mm-hmm.
See, now look, she has a better decreased kyphosis in this mid-thoracic region, and also her head is more up and back this way, and I bet you can breathe a little bit easier than you were before.
Yes, yes.
Good. Okay, if you don't mind sitting down right here on this table, and let's go the other way so Renee can get you. There we go. Would you mind telling our YouTube video watchers and subscribers what made you actually choose to come to Houston from Miami, Florida, and how this whole experience has been for you?
I'd be delighted to tell them, doctor, because it saved me, absolutely. Going to the emergency room at 2 o'clock in the morning because I couldn't catch my breath for 3 days was not a fun experience. And it was even less fun that they didn't know what to do. They absolutely took every blood test and every x-ray and MRI. The money was even incidental, but it added up. And then they put me in a room for 2 days, and they said they couldn't do anything to help me. So I was watching, I went on my internet the following night when I went home, and I found Dr. Johnson. And I said, this is amazing. This is God putting me in this direction. I really have to go there. I called him, and he was very gracious. I spoke with Renee, and she was extremely gracious and said, well, come on out. And I did. I came on out, and what a difference it's made in my life. What a tremendous difference. I can breathe. I can think.
Have you had any problems with your hiatal hernia since we started treating this?
No, as a matter of fact, when you asked me today to give you a number about what's disturbing me, I said 0.
Right.
Because I don't even feel that it's there.
Yeah, praise the Lord.
Praise the Lord,
Yep,
that's right.
that's great.
And praise you as well, because your technique is faultless, and the whole experience has been wonderful. I recommend so highly to anybody who has that breathing problem. And let me tell you, for night after night, when I couldn't sleep and I was on the internet all night long from
14 days, wasn't it?
14 days. I would be awake from 11 o'clock until 4 or 5 in the morning and take a little nap in the daytime. That's all the sleep I got. And I read everybody's stories, so many hundreds and hundreds of stories of people who didn't know what to do, and then they got the heartburn from the hiatal hernia and the terrible burning sensation. And this is the answer, really. I just feel amazing. I'm very tired, I have to tell you. This is actually my 3rd day.
Well, she's finally getting some sleep.
I slept last night from 10 p.m. until 4 o'clock in the morning. That's 6 straight hours. And I feel rested, and I feel strong, and I feel really so thankful and so grateful that I was able to do this.
We have a lot of people actually contacting us from all over the United States.
I would think so.
Asking us if we know anybody in that region that does this treatment, and I really can't tell you
that
that
about
there is.
region. Just get on an airplane. It's not a big deal.
So you would tell them the trip's been worthwhile?
Absolutely, 1,000%.
Okay, well, thank you so much. We're very honored to have Lenore and her husband here, Laura and her husband here, Clive, and we're going to get to Clive next, but this is your Houston chiropractor, and we'll see you next time.